I'm James O'Brien, and this is the standing hip flexor stretch. This exercise is great because it helps improve your hip extension range of motion by lengthening up the hip flexors. It's a very specific stretch toward activities like just standing in place and walking. A lot of the patients that I work with have a ton of pain, which is standing in place or walking, and that when they do so, they'll hyperextend their low back, which will generate pain. So by lengthening up the hip flexors, it can help reduce that. So to start, what you'll do is you'll place one foot up on a chair. All right. I have this video kind of zoomed out so you can see what's going on at this foot here on the ground. It's real important that that toe points forward for this exercise. So make sure that the bottom foot points forward. You'll place the other foot up on the chair. From this position, you'll stand up nice and tall. You'll put one hand on your lower back, and you'll flatten your lower back into, flatten your lower back into that hand. You'll do that by clenching this buttock. So I'm squeezing my left buttock right now, and I'm engaging the abdominals by drawing the pubic bone up and in towards my belly button. All right. I want to make sure that I'm not just lifting up my chest. A lot of people do this exercise. They lift their ribs up, they lift their chest up, but they overarch the lower back. That is not what you want to do. So instead, you're going to tilt the pelvis backwards by clenching the buttock, by drawing the pubic bone up and into the belly button. For most people, they'll feel a stretch in the hip here. All right. To advance the exercise and get more of a stretch, if you're not getting a ton of a stretch, back up a little bit further, then step up onto the chair. All right, and you can see in doing so, now my leg is further behind me. However, since I'm here, I need to make sure that although my leg is behind me, I am hip extending, not lumbar extending, and that's why I have my hand on my low back. So again, from here, I will clench the buttock, tilt that pelvis backwards. I'm getting a great stretch in the front of my hip. Things you want to avoid is when you're doing the stretch, if you want to increase the stretch, don't lean forward. If you lean forward, see, this hasn't changed the angle between my torso and my thigh here. I'm really in no hip extension. So that's not what you want to do. The other thing you want to avoid is if you start to come forward, all right, yes, you want to stay vertical with your torso, but don't arch your back. Remember, the goal is hip extension, not lumbar extension. So if you start to come forward like this, that's okay to do as long as you're not arching that back. And again, that is achieved through strong core engagement, drawing that pubic bone up and into the belly button, and also to clenching that buttock. Another common error with this exercise is when people bend their knee. And the problem is when you start to bend your knee, it brings your thigh forward and actually takes you out of hip extension. So it's very important when you do the stretch to ensure that your knee is straight, and in doing so, it takes the thigh backwards, thus bringing your hip into hip extension to stretch those hip flexors. I usually have people hold the stretch for about 1 minute on each side twice, so about 2 minutes total of stretching. This works best after some foam rolling. That is the standing hip flexor stretch.